Nano-Ayurvedic medicine and its potential in cancer treatment. This is printed in Science Direct. It was originally printed in the Journal of Integrative Medicine, Volume 21, Issue 2, March 2023. Abstract. Nano-Ayurvedic medicine is an emerging field in which nanoparticles are functionalized with active principles of potent Ayurvedic herbs to enhance their efficacy and target specific delivery. Scientific advances in the past couple of decades have revealed the molecular mechanism behind the anti-cancer potential of several Ayurvedic herbs, attributed chiefly to their secondary metabolites, including polyphenols and other active substances. With the advancement of nanotechnology, it has been established that size, shape, and surface chemistry optimized nanoparticles can be utilized as synergizing carriers for these phytochemicals. Nano-Ayurvedic medicine utilizes herbs that are commonly used in Ayurveda to functionalize different nanoparticles and thereby enhance their potency and target specificity. Studies have shown that the active phytochemicals of such herbs can be coated onto the nanoparticles of different metals, such as gold, and that they work more efficiently than the free herbal extract, for example, in inhibiting cancer cell proliferation. Recently, in Ayurveda, yoga, and naturopathy, Unani, Siddha, and homeopathy, Ayush-based clinical trial in humans indicated the anti-cancer potential of such formulations. Nano-Ayurvedic medicine is emerging as a potential treatment option for hyperproliferative diseases. Introduction. Recent years have witnessed an avalanche of research output exploring the structural and functional aspects of different types of nanoparticles. Shaped and stabilized by various means, these nanoparticles can be used in various biomedical applications. Recently, several studies have reported the cancer therapeutic potential of metallic nanoparticles. Among metal nanoparticles, the clinical potential of gold and silver nanoparticles have been known for a considerable time. Gold nanoparticles in particular have been studied extensively for their cancer treatment and theranostic applications. Notably, even when stabilized with common agents such as citrate or tryptone, these aggregation-resistant nanoparticles display considerable anti-cancer properties and interesting mechanisms of action. For example, tryptophan-stabilized gold nanoparticles can elicit cell cycle arrest at both the G1 and S phases in pancreatic cancer cells. In this case, combining these nanoparticles with a drug that arrests cells in the G2M phase would assist elimination of cancer cells that display stochastic cell cycle kinetics. Another exciting finding is the ability of these nanoparticles to selectively eliminate triple-negative breast cancer cells. Unlike normal cells, TNBC cells harbor multiple copies of centrosomes, the cellular organelle that nucleates microtubules. Commonly called supernumerary centrosomes, these extra centrosome copies help the cancer cells to remodel their cytoskeleton, facilitating their migration and metastases. Tryptophan-stabilized nanoparticles could kill such cancer cells by forcing the centrosomes to form a cluster at one pole of the cell, a phenomenon called unipolar clustering of supernumerary chromosomes. Moreover, these nanoparticles can target tumors both passively and actively. Passive targeting utilizes defects of a tumor, such as leaky vasculature, that enables the nanoparticles to seep into the tumor tissue, and defective lymphatic drainage system that enables retention of the particles within the tumor. Since only a fraction of the nanoparticles injected into the body can reach and be retained by the tumor site by passive targeting, active targeting using tumor-specific peptides and antibodies is being actively explored. For instance, by conjugating therapeutic nanoparticles with an antibody that targets human epidermal growth factor receptor 2, HER2 overexpressing breast tumors can be targeted. Similarly, the cyclic arginine glycine glutamate peptides can be attached to gold nanoparticles to target specific estrogen receptors that are overexpressed in several tumors. Traditional Ayurvedic herbs and their anti-cancer potential. Ayurveda is a medical practice that originated in India thousands of years ago. The majority of Ayurvedic drugs are derived from herbs, rather than relying exclusively on individual chemical molecules for the desired therapeutic outcome. Ayurveda focuses on the combined and pluripotent effects of active substances and their optimal proportions in its treatment modalities. The system considers every individual as unique, and hence the treatment protocols may vary. Modern medicine has also the emergence of Nano-Ayurvedic medicine and its potential for cancer therapy. As cancer therapeutics, Nano-Ayurvedic medicine aims to combine the therapeutic properties of herbs with the tumor targeting and anti-proliferative propensities of nanoparticles to bring forth a synergistic anti-cancer outcome. For example, by functionalizing gold nanoparticles with phytochemicals, their tumor cell-specific cytotoxicity can be improved. To give the formulation enhanced target specificity, suitable tumor-targeted molecules can be tethered to it. Concluding remarks. Green synthesized nano-Ayurvedic formulations, including those based on gold, could be largely devoid of dose-limiting toxicity to patients. With gold-based nanomedicines, for example, the inertness and biocompatibility of gold coated with active substances from medicinal herbs could contribute substantially to a reduction in side effects. However, even though their potential for treating different types of cancer, the author declares no conflicts of interest.